So, Mark, thanks for agreeing to do this brief interview with me. Tell me, first of
Pleasure.
all, a little bit about your psychotherapy practice.
Well, I'm a psychiatrist,
Yeah.
so I do a mixture of medications and psychotherapy, and I work with people with a lot of addictions and
Hmm.
complex disorders.
Hmm.
And I've been doing different forms of psychotherapy for 20 years.
Hmm.
Started off in a more traditional psychodynamic model and relational psychoanalysis. Then along the way, lots of other psychotherapies,
Hmm.
and came to ADP
Hmm.
about 4 years ago,
Okay.
and um, have shifted a lot to ADP, although I still incorporate a lot of other models into my approach.
Sure. I understand. I do the same.
Yeah.
Good. So you've worked quite a bit with SueAnne Piliero, who's coming here to give this workshop. Tell me about her as an instructor and supervisor. What's it been? What have you learned? What have you taken from?
Well, I've worked with SueAnne both in Essential Skills 1,
Hmm.
and then I had a different supervisor for about individually for about a year or so, but sought SueAnne out because I felt she would particularly be able to guide me towards the use of myself and
Hmm.
the deep engagement of my own emotionality in the work.
Wow.
I tend to be more clever, cognitive. I'm just noticing I've got this behind me, and
The map, yes. Okay.
yeah, and I could see from SueAnne's work, which is infused with so much passion and, as
Mm.
she calls it, fierce love,
Yes.
her judicious use of herself.
Hmm.
And she does that in a very precise and powerful manner.
Wow.
And I wanted to get better at that,
Mm-hmm.
particularly.
How have you experienced that changing your practice or changing you this way?
Oh, dramatically helping my psychotherapy practice.
Wow.
I'll, as we do during training, we tend to model ourselves on our mentors at particular
Yeah.
times, right? And I find myself channeling SueAnne, but over the years, because I think she's been supervising me for a couple of years,
Hmm.
it's become my own voice increasingly. She's encouraged. I've been able to find my own voice, but still channeling the lending of myself and
Hmm.
um, the very overt sharing with the patient of my somatic and emotional experience
Hmm.
about them in a
Hmm.
way which is very impactful, and being able to um, join with the patient in a deeply compassionate, empathic way.
Right.
And I was um, talking the talk for years, and I'm walking the walk now.
Hmm. Hmm. How have you seen this shift in your practice and your way of using yourself affecting the outcomes with the patients you're working for?
Um, a example from this afternoon
Hmm.
would be um, a working with a patient with um, a great sense of shame and an anxious avoidance
Hmm.
of that shame, and talking about the only way really to help him feel joined in the vulnerable aloneness of
Hmm.
his pain, to shift from his self-attack
Hmm.
to a compassionate healing, was to share with him in a very overt way my feelings
Hmm.
about a very vulnerable, uh, um, alone and hated part of himself,
Wow.
to transform that hated part into something that we could be together with and care for, and love, and to be able to sort of speak, um, with um, with the kind of overt caring
Hmm.
for him was something that I feel is I owe to SueAnn.
Wow, that's a wonderful recommendation. I want to
Mhm.
just ask you one more question, which you talked about the judicious use of self. So tell me a bit about that.
Well, SueAnn is very careful and precise about how she's lending about these what used to be called boundary violations,
Right.
right? I mean,
Mhm.
this use of the countertransference and
Mm.
sharing of our own experience,
Right.
and but SueAnn does not do this in any wild way, nor is she
Mm.
doing it because she wants to the patient to feel her.
Right.
It's not about SueAnn.
Right.
It's a titrated lending of her own emotion to evoke a particular emotional experience in the patient,
Hmm.
and in the shared experience between her and the patient,
Hmm.
or to enable the patient to begin to take in that compassion and model that healing, so that the transformance drives the um, the sort of caring, healing desire for connection within the
Hmm.
patient can be awakened. But she'll do it in a way where she's really um, she knows when she's doing it, she knows how she's doing it, and she's watching for the effects to be
Wow.
able to help the patients really utilize that in a way which is going to be healing.
Wow. Thank you so much. I really appreciate you taking this time. Um,
Pleasure.
yeah.